The first skeleton came in this box, and if you open the box up, you would see the polystyrene case, and if you lift it up, so it comes in a two-piece casing, and you'd see that the skeleton sits nicely in a cutout niche to protect it whilst on transport. And taking the skeleton out, you'd see that it's not articulated with the lower limb. That's still here, and what you would need to do is you need to take off this cord stopper like so, and you would need to thread this elastic through the acetabulum that you could see here. If you thread that through, and then you can reattach the stopper, which I will show to you later on. So let's just put this back. And what you'd also see is that there's this paper packing into the rib cage just to help keep the rib cage proper shape whilst on transport. And if we're going to take all of this out, okay, what you'd see in the box is that there's another piece of paper, and it's actually a poster. It's an A3 sized poster of the skeleton with all the nice names, properly labeled poster, so you can hang it, pin it on your wall. On the back side of the polystyrene casing, you'd find here the base, and you also find here the rod, which would you'd have to insert the skeleton on. And here at the bottom part, you also have a metal weight that you would need to put here so that the base would be stable, and some washers and nuts to keep the rod in place for the base. So this skeleton is the unmarked version, and that would go to my niece, who's also studying physiotherapy in the Philippines at the University of Santo Tomas. So she's going to use that for her study of anatomy. The next model that I would like to show to you also came in a similar box with a similar polystyrene packing, and the skeleton looks like this as well. What you would immediately notice difference is that the skeleton has all of these red and blue markings painted on the right side of the skeleton. The red indicates the origin of a muscle, and the blue indicates the insertion of a muscle. Each painted part here on your skeleton corresponds to a specific muscle. And if we take this out, okay, so what you would see here is this manual for the muscle, and it lists all the different muscles that you could find marked on the skeleton. And so if I would give an example, you could possibly read this one. Yep. So it says here, a pectoralis major muscle, number 1. And if we have the skeleton here, you can see the number 1, pectoralis major. So this shows the origin for the pectoralis major. The insertion of the pectoralis major is something that you'd have to look for yourself. Here it's labeled, it should be here on the humerus, but what you would see, you see, I think, numbers, let me see. So you're seeing, I think, hopefully 2, 19, and 18. So there is no number 1 insertion for your pectoralis major, which is an issue I would go back to later. So it comes the same thing with the base. Yeah, this has already fallen out of the box because I've put this out a few times already. And so what you would need to do when you're assembling the base is you would need to thread this like so. And then you would need to insert it here. And if you can take the weight, so this metal plate is quite hefty. It adds stability to the base. And you put it together like that. And inside here, the packaging, you'd find a nut, and you screw that also in like so, and there you go. So you have a quite stable base. The model also comes with the same poster that you saw already. So the only difference between the first and the second model has to do with the muscle markings. It has to do with the origins. It has to do with also the insertions. So that's the only difference between the two. Aside from that, they look similar. They are similar, as you would notice here on this unpainted side. All the rest are quite similar. I have to say that I'm quite amazed at the way they modeled this bone. I think they scanned this from a living person, and they somehow were able to reduce this and make molds out of this, because all the different markings that you would expect, the different unevenness of the bone, like for example here, hopefully you can see that, and even those pock marks up here, what you would find on the real bones, it's quite faithfully reproduced, I think. So I think this is in terms of the way it looks, this is a quite good model, the same as the unpainted model without the markings for the muscles. Next, I would like to show to you this box. So this is the one, the third model. And if you've seen already the box, so it doesn't come with its polystyrene packaging. It just comes with this paper packing, and also the model is just wrapped in bubble wrap. The base of the model is in the box, and it's already pre-assembled, and as you can see, there is no weight to it, so I think this is going to be quite it's not going to fall over or tip over easily, but I would have preferred some weight to this, so I know it's quite secure when I have the model standing on the table. But when we have the model here now, and so this is the model itself, and what you can see is that it's just wrapped in bubble wrap, and the rib cage also has bubble wrap stuffing inside of this. So let's just take this out. And the difference, aside from the way it's presented in the packaging, is that the lower limbs are already articulated with the rest of the skeleton, unlike the other one, which you'd have to thread through. Another difference is the way you would attach the joints. So here we have, for example, if you can possibly see the way the hip is attached to this. It doesn't have a stopper, but it has this metal plate which you'd have to arrange so that it doesn't go into the hole itself. So when you just pull on this elastic, this metal thing plug would also slip inside, and you could easily take the lower limb out and, you know, just apart from the rest of the skeleton. If you just want to study the femur, then that's quite possible and easy. One thing that you might notice when I said earlier about the way the bones have been modeled is this one came from those two earlier models. It looks like it has those bony porousness that you could see, and unevenness up there. So there seems to be like pock marks there, trying to make this bone seem like it's been modeled after a real bone, but I think this is just sculpted from clay. So this is, I think this is made of a sculpted model, whereas the other models, the other two models, they were made from bone scans, I think. So for me, the first two models are more faithful in terms of the bony landmarks compared to the second one, or the third model. The benefit of the third model, as you can also see, is the different joints can be removed. So we've removed the femur from the pelvis. You can also remove the tibia and the fibula separate from the femur just by here, same system here, pulling on this string, and what would happen is it would slide outwards and there. So now you have a separate femur, and you now have a separate tibia and fibula, lower leg and ankle. So the third model that I've shown to you, that comes from Erler-Zimmer, and the first two, the ones I've ordered here in the Netherlands, they come from the company called Cranstein. And I think in the US, at least in the North American hemisphere, that I think is being sold on Amazon under the name Cranstein Scientific. So what you would see with these two skeletons placed side by side is, I think, for one, the rib cage. The Cranstein model has a wider rib cage. They're more horizontal, whereas the rib cage of your Erler-Zimmer, it's more it's narrower, and also they're slanting more inferiorly. And also the way the rib cage has been constructed here on the Erler-Zimmer model, you'd see that the cartilage have been approximated by a clear plastic, but here on the Cranstein model, you'll see that they're just been painted on. And well, for the rest, well, here you have the spinal nerves. They're coming out on the sides through the intervertebral foramen, and the spinal nerves are just plain transparent plastic, much like the intervertebral discs. But here on the Cranstein model, you would see that the spinal nerves have been given a yellow color. And also here on the Cranstein model, there is this red bulging plastic, which is supposed to represent a lumbar hernia, which you would not find here on the Erler-Zimmer model. Just looking at the frontal aspect of the skeletons, you could also see that the pelvis here on the Cranstein model is what you would also see in your atlases, in your anatomy books, whereas here on the Erler-Zimmer model, it looks more boxed. It has a sharper, deeper fossa here compared to the fossa here on your Cranstein model. And for me, in terms of preference, the way I remember the books, I think I would prefer the Cranstein model in terms of the way it looks like. So I suppose this came about as an interpretation of the artist who sculpted this model, whereas I think this one, it was made of a scan of a living person. So that's in terms here on the anterior side. And if we turn the models over, you could also see that here on the back, okay, there's a difference. So your Erler-Zimmer models, moving them up closer to the camera, all of the ribs are attached to the thoracic vertebra via these wires, and that means that this is a flexible skeleton model, and that means that there is some movement possible between your thoracic vertebra that you would find here on your Erler-Zimmer model. However, in the Cranstein model, all of the ribs have been glued on to the thoracic vertebra. So even though this is also a flexible spine model, it's impossible to have any movement at all at this segment of your vertebral column. You will have movement here on the lumbar spine, so let me show you that. So you see that there is movement in the lumbar spine, but if I try to have some movement here on the thoracic, I'm pushing down, there's no movement at all. Here at the cervical column, you would have some movement available, not a lot, because I think the armature inside the Cranstein model is somewhat stiffer compared to the one here on the Erler-Zimmer. So if I'm going to bend the lumbar spine, you can see there's a lot more bending. It's easier to bend the lumbar spine, and if I try to have some movement at the thoracic spine, I would be able to have some. Also here at the neck, that's because of the armature that's been used in this model. I think it's a lot better armature. And I forgot to mention, the Erler-Zimmer model also has a red wire going up both sides of the neck. So those wires, they represent the vertebral artery that goes through the transverse process foramen that goes for the blood supply going to the brain, which is a detail that you would not find on the Cranstein model. Comparing these two models side by side, I think the reason that you would choose for the Cranstein model is if you're after something that's quite affordable, that would fit your need to have something to remind you about the musculoskeletal anatomy. I think both of them would be good. However, the Cranstein model has the advantage of being cheaper than the Erler-Zimmer model, even though you have this model which has been marked with origin and insertion. Typically, if you would get a mini skeleton model like this and you want the origins and insertions of the muscles, you'd have to pay a lot more. Something like this characteristics on this model here, the Erler or this company here, you might pay 500 to 600 euros for something that has also a flexible spine. So yeah, if you're just looking after something simple, I think this would suffice. My preference in terms of the way the models are faithful to the pictures found in atlases, and also whether they're illustrated or photographed. I think that's most authentic or most faithful here with the Cranstein model, whereas the Erler-Zimmer model gives more realism, is more faithful in terms of the flexibility, movement of the spine. One thing that's quite similar in both models is, I think, the skull. So to remove the skull from the Erler-Zimmer model, you just have to remove this plastic cap here, which protects the top end of the armature. You just remove the skull cap and you just lift off the skull like that. So this is the skull from the Erler-Zimmer model. And to remove the skull from the Cranstein model, you'd have to press the sides, the temples, very gently, and then try to pry up the skull cap. So just like that. So I just pop it like that. So this is your skull cap, and you'd see the inside of your cranium. There's this screw that you can turn, and once that's been removed, you can also easily just lift the skull up. But this skull has this plastic part here, and what I would advise you to do is to pop this back onto the skeleton and bring back the screw again, so that if by chance you would like to move the spine, you can easily move the spine and not dislodge the vertebra from their positions, because they could easily just go up and down the this wire armature, and you'd have to, I think, figure out how to put back, for example, here, all in the right place at where they should be. Yeah. So this is a so this is the skull from the Cranstein model, and this is the skull from the Erler-Zimmer model. Let's put this into more. Good. So I think they fairly look the same. I think they came from the same mold, because the suture lines and also the molding lines, they're fairly the same. So I could safely conclude that they came from the same mold, but the difference between the two skeletons really is also in the way they've been, the skeletons have been sculpted. So if you go back again to the skull, since I mean the skull, so we'll just take the one from Cranstein, and you see a fairly detailed modeling. You could also see the roughed surfaces, the lines, the grooves. You could even see the different foramen the foramina, where nerves exit into the head, so they come from the brain. So the brain sits here, and it sends cranial nerves out. Some of the cranial nerves go into the brain, and they pass through those openings. And I think the surfaces here are quite realistic. So yeah, the edges, the crests, they are what I would have expected in a full-sized skull. The jaw is attached to the skull by means of this spring here. So by means of the spring here, you see that the jaw is attached to the skull, and to be able to open and close the jaw, you just have to hold the head carefully and carefully pry open the jaw. You can easily dislocate it this way. Yeah, so put it back, just like that. Yeah. So, yeah, I think both model skeletons are good study tools for physiotherapy students. Well, even after you've graduated, you could help to educate your patients about their bodies by showing them these models. But if you're a student and you would like to learn about the origins and insertions of the muscles, and you hope to just learn them off the skeleton, this particular example here, I would not advise that, because although the markings are fairly where you would expect the different muscles to come from and to attach to, they're not entirely accurate. So one example I could share with you is if we look closer here on the skull, and you see the first red line, that is the origin for your trapezius, the trapezius pars descendens, or the descending part of your trapezius. And underneath that you'd have the blue line that indicates the insertion for the semispinalis capitis muscle. Now in other books, let's say in Gray's Anatomy and in the Macnin's Atlas, you would find that the insertion of the semispinalis capitis is roughly on that area here where my pinky is, and that's where you have the roughened part. So that's the roughened part of the bone, and as I said earlier, it really indicates the attachment for a muscle or a ligament. And in those books, you'd find the semispinalis capitis indicated to insert in that area, whereas in this model you only have this line there. I think on general imbalance, this model here with the origin insertion markings, they have here, I think, a good balance between cost and the quality of the craftsmanship, because yeah, you have to balance the time that you would spend painting this model with the amount of money that it's being sold. So at quite, I think it's not cheap, but I think it's still affordable. If you have a budget of around 150 euros, you can get this model, but just use the markings as a sort of like general guideline for where the muscles originate and insert. If you really want to have a very accurate depiction of the origins and insertions of the muscles, you could either shell out a little more euros for a model, or you can opt to buy the first model that I've shown to you, just a plain model without the muscle markings, and you can paint them yourselves. I think you can easily buy paint from a model miniature shop and just get a red, a blue and a black one, so you can mark it off. You can paint it off yourself. That's possibly going to help you learn the muscles as well. If you have to compare the books and you have to go back to the bones, so that might be helpful. So yeah, there you have it. So that's the review for the mini skeleton models from Cranstein and from Erler-Zimmer.